This nature telling us we need to reshape and we need to rethink on how to interact with her.
Hey Lawrence,
Hey Josh.
I've been thinking about the podcast. How about in the first series we focus on the pandemic?
Yeah, and in each episode we can ask our guest how it's been affecting them and what they do.
We could ask people to join in with the hashtag #PosNegative.
How would we introduce it each week?
We'll just say, welcome to Positive Negative.
Today, I'm going to be speaking with environmental journalist Cyprian Ogoti. I met Cyprian last year at the Clean the Air conference that took place in a rural village in Bore, Kenya. I spoke with Cyprian on Sunday the 26th of April. It was great to catch up after so long and hear about how he and his family are coping at this time, and get a personal insight into how Kenya is responding to the pandemic. Hey Cyprian.
Hello, good morning.
Hey, how you doing?
I'm doing great.
Could you start by telling me who you are and what it is that you do?
My name is Cyprian Ogoti. I am an environmental journalist, come environmental activist. That's what I do in my daily basis since the last time I graduated in 2012 with print journalism. I've worked in South Sudan for 3 years. In South Sudan, I wasn't actually doing the journalism beat, but I was working in a humanitarian Catholic-led organization for 3 years. So I was in charge of communication and also helping in humanitarian crisis and emergency reporting.
Wow, that's pretty impressive work there, Cyprian. And what's the effect of the coronavirus and COVID-19? And Kenya is on a lockdown, or Nairobi's on a lockdown, is that correct?
Yes.
Yeah, so what's the situation there?
I want to share general situation as a country, then lower it down to my personal level. As a country, the first COVID-19 patient was reported a month and a half ago. Mm-hmm. That's when the government decided to take measures. And the first measure was to do a curfew for 21 days from 7 p.m. to 5 a.m. at night. Yeah. So the curfew was gone actually it lapsed yesterday. But the government has also added another 21 days, so making it 6 weeks.
Is that across the whole country?
Yeah, it affects all the country, but there's some few individuals who are, we call them essential services, the nurses, the doctors, the hoteliers, for those who deal with food products. They were given an exemption, but when a curfew is imposed, if you don't, unlike other countries, our police sometimes they harass people, even if you have the papers. So it's a total lockdown from 7 p.m. to 5 a.m. So nothing goes on. It's only the police on the street, and if you got on the wrong side of the law, surprisingly, you are taken to quarantine by force.
Oh, okay.
Yeah, so it's scary to people. It's tormenting to people.
But during the day, everybody's allowed out?
Yeah, during the day, you can. Okay, there's a partial lockdown. I can operate within Nairobi, but I can't go outside Nairobi.
Okay.
During the day, I'm allowed to go within the boundaries of Nairobi Metropolitan, which covers part of neighboring counties of Nairobi. But now you can't go outside Nairobi. So those are two implementations that the government has set up in place.
Yeah. So similar here, but we're on a bigger lockdown than you. So we can go out. I suppose you can go out at any time, but it should only really be for exercise. And similar to you, the essential services are still running.
What are the classification of the essential service according to your government?
Similar to you, hotels here are closed actually. Hotels are pretty much just open for
workers that can't go back to their families. So if you are working in the NHS, many people are staying in hotels just in case they catch it and then they can't won't pass it on to their families. So police are still running. The hospital, obviously, the hospitals. Actually, people that work in supermarkets. So the only shops that are really open are places that sell food. So if you checkout worker or stack shelves, then you're considered an essential worker. But everybody else has been told to work from home if possible. So it's, yeah, and we've had that. That's just last week it was extended. So it started as 3 weeks and then it's been extended for another 3 weeks. And it's looking like it's just going to go on for quite some time.
Yeah, we had fears of a total lockdown, but I think the government considered several issues. In fact, all hotels and eateries were closed down since the second week of into the breakout of COVID. But
Okay.
yesterday the president was giving no yesterday, but on Friday, the president
Yeah.
was doing a brief, and they'll consider some hotels to reopen, some hotels and some eateries to reopen, but you must adhere to the laws that have been set, the social distancing. They're going to they don't want people to go in a crowded place.
Is it impacted on your work at all and anybody that you work with?
Yeah. First, as a freelance, I used to depend on contracts, and being I don't belong to that essential services. I'm a journalist, and I used to do environmental matters. I expected my work to pick up during this COVID, but it's the opposite. Because one, being a freelance, I wasn't employed anywhere, and as a freelance, we depend on donations and contributions from like-minded persons and like-minded organizations. So for the few weeks, my work has been actually not supported. I expected to get some funding for the river cleanup through the government agency, but since this emergency came, the government has redirected all the money to fight for the virus. So let me say, I've been jobless. Sometimes I can even miss a meal because
Oh, wow.
you can't get. Okay, freelance. The pity thing of freelancing is, you can have a job and it pays off. It's hand to mouth, let me say, which is really hurting on my side.
And there's no government support for freelancers or any businesses?
No, there's nothing. I don't think the government is thinking of doing that. What they did is for the old people, but you have to register with them. So the youngsters, we are really suffering. Okay, on my side, actually, right now I'm depending on my wife who's working, who's a nurse. So she's the one providing for the family at this moment. Yeah.
How's your wife's work? Is she?
Yeah, she works with the emergency department, meaning she's the
Yeah.
first contact when a COVID patient walks in. Then they have a special ward in the hospital. Though
Yeah.
some of our colleagues have been quarantined because they come in contact with the COVID-19 patients. But her, let me say she's lucky she has not been in contact with any COVID-19 patient. And the good thing is their hospital has really put in measures of the PPEs. So they're always on masks, they're always on the PPEs wherever they come
Oh,
in
that's
touch
good.
with. So their colleagues, unfortunately, a patient walks in and he or she doesn't share the travel details. So you might treat him or her as a regular patient, and unfortunately, you get his
Yeah.
is a COVID-19 patient. So that's how the colleagues ended up in quarantine. And the hospitals, they had satellite clinics, and one of the nurses had a travel history. She's actually positive of COVID, and
Wow.
she has recovered. She's been in hospital for the last 3 weeks.
Oh, that's good.
Yeah, she's fully recovered with
Yeah.
her two kids. So it was a shocker to them, but the hospital contained it.
Oh, that's pretty good. And the hospital over here, we have big problems with PPE. The hospitals can't get enough of it, so we're really undersupplied. But you guys are okay with?
What the government did, we outsourcing locally. We had some industries, like one of the counties, they fully stopped the production and did the PPEs. So, but our worry is if we get more cases, we might end up in the wrong side of the COVID-19. So we are praying for now. But I didn't share. For now, we are 346 patients who have tested positive, with 84 recoveries, then 16 deaths so far.
Do you know how many people are possibly infected? How's the tracing going on?
So far, they have done around 20,000 tests, which is way low, below. We have 50 million Kenyans. So another challenge we have is the testing kits, because they came in late, and we are depending on the government, because Cambridge is the government agency which does the testing. They had the machines, but they didn't have the reagents. But the president said a few weeks ago that everything now has been put in place. So we expect the mass testing, which I think is starting next month.
Okay, that's good. And is there a worry? Like I always think of when I think of Kenya or COVID in Kenya, of Kibera, where you've got a lot of people living in very close proximity to each other. Is there a worry of it spreading through an area like that?
But surprisingly, we don't have any case from Kibera. Surprisingly, the places have been hit actually are the let me call the poshy areas like Kilaleshwa, Lavington, Karen. But so far in Kibera, by the up to date, we have not reported any case of COVID. And
that's good.
Mombasa County, Mombasa town, actually has the second highest from Nairobi. There are 94,
really?
96 cases right now reported, compared to 100 and something in Nairobi.
And is that purely because of those people are traveling, or people are traveling to Mombasa?
Apparently, we used to the tracing was done for those people who travel outside the country, but surprisingly, the cases that have been reported for a few days actually are the locals. They don't have any travel history. They have not traveled anywhere outside. So, meaning COVID is within now the locals.
Have you seen any sort of positivity come from the situation? Is there any inspiring stories or anything like that you've seen since the start of the pandemic?
I think the number of recoveries it's increasing, and because we are at 84, and the government is putting on measures. We thought it will be worse, but we thank God for this far. And we they said Africa. My worry was our medical facilities are not that good, and we expected worse to happen, but we are reporting that so far so good. The government is doing really pretty job in terms of containing the virus.
Fantastic, that's really good. Kenya's one of my favourite places, so I'm glad to hear you're doing well.
Yeah, the issue right now is the economic conditions of most people like us. Some people have actually even committed suicide. Some are so depressed. Some are divorcing. Oh, wow. There's so many psychological issues going on in various families, and right now the government is not into that area because it's concentrated on how they can defeat this virus. And by the churches are closed down, mosques are closed down. So even if you have such courts are not working, so even if you have those conditions, it's very hard to seek to sort help from the various institutions. So you get a family which is depressed. There's no one to talk to. There's a lockdown, as in visiting the social life has been totally been affected per se.
Yeah.
So you get families that are deeply into depression, deeply into a lot of issues, stress. Others even go to an extent of killing themselves. So that's the worry right now. Uh,
Yeah, that's a huge worry.
and also the other one which is overlooked is the hunger, because people don't accept. Initially before COVID we had locusts. So locusts they attacked our, let's say, our green basket. So after the locust, which are actually they have not like totally disappeared, we have a really acute shortage of food in various our government reserved have run dry this, but the government said the food can come in from outside. They haven't locked up a movement of food, but we are going for a tough times in terms of food security.
Yeah. And is the food that's coming in from outside, is that more expensive than if it is food produced locally?
No, it's coming from the neighboring countries like Uganda and Tanzania. Yeah, it's not like from outside overseas.
It's not.
Yeah, we've been doing that even before.
Yeah.
So it's just coming from the local neighboring countries.
In what ways do you think, or do you hope that this pandemic will shape the future?
Yeah, let me say this will be the new norm, the new normal, as in social distancing will still go on, and it's not ending soon. People, let me first say, COVID has helped the mother nature to heal. In fact, I can go to Nairobi and see Mount Kenya. I don't know whether you know Mount Kenya. I can see Mount Kenya
Yeah.
from Nairobi. I can see Mount Kilimanjaro from Nairobi. So that tells you something. Pollution cases have gone down because no much movement in terms of air pollution. So the skies have cleared. So it's gonna shape the future. We need to rethink of how we handle ourselves. The hygiene part will is here to stay. We will not be like careless as we used to be initially before COVID. It has really taught us a lesson of rethinking of how we interact with each other. Though the social distance, and human beings are social animals. It won't like break that chain. We'll still have our
No.
social life, but on a careful manner.
And do you think those things will stay? Do you think people will see this as an environmental issue and respect the planet more?
Unfortunately, I don't know whether most people think this is an environmental pandemic. Most people think it's a biological war. But my thinking is this is nature fighting back. This nature telling us we need to reshape and we need to rethink on how to interact with her. Wangari Maathai stated that nature is unforgiving, and for sure, this is the first-hand reaction we have seen how and what Mother Nature can do to us if we are not amending our ways of interacting with her. So I hope the message will reach out to many people. We have seen it. It's something that it's not a story to be told. It's something we got first-hand information about it. We have seen it with our naked eye. So we need to rethink of how we're going to interact with nature, and this really calls for our future. How we'll handle our future in terms of conservation of nature.
And I can hear your child in the background. What kind of effect has this had on him?
No, him has been indoors.
Yeah.
Actually, schools were closed down.
Yeah.
In 3 days to the first case, when the first case was reported, so schools were
Okay.
closed down after the 3 days. He has never ever stepped out of the house. Even himself,
Yeah.
he says, if I go there, I'll catch corona. So he knows corona
Okay.
exists.
How old is he?
He's turning 5 next month.
Okay. But is he missing seeing friends and playing?
Yeah, but he's kind of okay. I can't call him paranoid, but he's kind of careful. Because when I tell him,
Yeah.
we have a huge compound outside, but he's so skeptical. Oh, I can't go out there and play with my friends. I'll catch COVID.
Okay.
So he's kind of being careful.
Yeah. Well, it's wise to be careful, I think.
Yeah, sure.
Are there any questions I haven't asked that you'd like to answer, or anything else you'd like to talk about?
I think we have emptied everything, apart from relating COVID to climate change. I think
Yeah.
the Earth, Mother Nature has exploded. I think we pushed into the limit, and for me, I can say as an environmentalist, this a reaction from Mother Nature, and we need to rethink of how to change it and how to take climate action, and that for sure it will help us in the near future.
Is there any way that people can keep in touch with you or follow you on Twitter or anything like that?
Instagram, it's Ecomazingira. Ecomazingira is ECOMAZINGIRA. Then Facebook, it's Cipriano Chagina. Cipriano is Cyprian, then you add O. Chagina is CHAGINA. Yeah, you can reach me through those.
Fantastic. And do you have a blog or anywhere people could read some of your work?
My blog has been dormant this year. It goes by the name Ecomazingira Blogspot.
Fantastic. We can link to that as well. I know it's been dormant, but people might like to read what you've previously written. Cool. Okay, thanks very much, Cyprian. That was great.
Yeah, you're most welcome, and thank you very much.
Thanks for listening to Positive Negative.
Don't forget you can follow us on Twitter at PosNegative or find us on Facebook.
And join in the conversation using the hashtag PosNegative.
You can help us to grow by leaving us a review and sharing this episode with your friends and followers.
You'll also find links to what we've talked about in the show notes, or by visiting positivenegativepodcast.com.